welcome to Askimo TV. We're talking today to Dr. Romesh Angunawela. Dr. Angunawela is a consultant eye surgeon specializing in corneal and lens surgery and laser eye surgery at Moorfields Eye Hospital in London. Hi, Dr. Angunawela. How are you?
Good morning, Joanne. It's a pleasure to be here.
Lovely to be talking to you today. Dr. Angunawela, let's talk about corneal transplantation. What is corneal transplantation?
Corneal transplantation is very simply the removal of part of the diseased cornea from a patient and replacement of that area with tissue taken from a corneal donor. And that's usually from tissue that's been donated by someone who's passed away.
How do I know if I have corneal deterioration?
Well, it's really difficult to tell yourself whether you have corneal deterioration. It's something that your eye doctor or eye surgeon will be able to determine by examining you. But a simple sign really is some sort of loss of vision. Unfortunately, loss of vision can be caused by a number of different eye problems. It's difficult to specifically say that that's a sign of corneal disease, but loss of vision or reduction in vision is an early sign that can be caused by corneal problems. Other things like noticing that there's a white area on the cornea or some sort of opacity of the cornea can also indicate some sort of disease of the cornea. The cornea, just to be clear, is the clear window at the front of the eye, a little bit like a watch face on your watch, and that's the main component that focuses light on the back of the eye. In advanced corneal disease, you may notice that your vision fluctuates, so that when you wake up in the morning, your vision's worse, and then as the day goes by, the vision improves. That can be a sign of corneal dysfunction that improves later in the day. And in even more advanced cases, you can just notice that you have severe pain affecting the front of the eye, like a stabbing pain caused by blisters that can occur on the cornea.
What are the benefits of corneal transplantation?
Well, the aim of corneal transplantation is to remove diseased or non-functioning parts of the cornea and replace it with tissue from someone else that is functioning normally and that is clear. So the aims really are multifold. One is to restore the structure of the cornea. Two is to restore its clarity and its optical properties. Three is to restore the strength of the cornea if it's been weakened in some way. And all of those things combine really ultimately to return the patient's vision to what it was before they had their corneal problem. That's the ultimate goal of doing corneal transplantation. Now, the patient may need to wear glasses after having corneal transplantation or even a contact lens to help them see very clearly, but ultimately the reason we do this surgery is to help people see better.
Who is eligible for corneal transplantation?
Well, patients having corneal transplantations come at any age. So there are children that are born with corneal problems that require transplantation, and at the other end of the spectrum, we have patients in their 90s who develop corneal failure just as a consequence of aging that require corneal transplantation. So there's no age barrier to having this sort of surgery done. There is a lifespan that these corneal transplants have. So if you have your surgery in your 30s, for instance, it's very likely that when you reach your 60s, you may need to have the corneal transplant replaced or rejuvenated in some way using cells to help them work better. But anyone at any age can require and can have a corneal transplant performed.
Who are the donors?
Well, donors are very kind people who've donated their organs for transplantation at the time of their death. And they usually sign a donor card in the UK at least, and other countries as well, I believe, which allows those organs to be harvested and used for treatment of disease in other patients. So their kidneys, lungs, heart, liver, and eyes will be used to help other people have a better life, really. So it's a very altruistic and kind thing for people to do that we try and encourage, because there is a shortage of donor organs all around the world. Thankfully, in the UK, we seem to have sufficient donor corneas for the number of corneal transplants that need to be done each year, but that's not the case in other countries.
Just to end off, what are the risks, if any, in having the corneal transplant surgery?
Well, all eye surgeries carry some risk. Common risks of any surgery really are things like infection or bleeding, and so all patients are given intensive antibiotic drops usually to prevent any risk of infection. More specific to corneal transplants is the risk of rejection of the transplant, and that's a process that occurs because you're transplanting essentially foreign tissue from another person into your body, and the body recognizes this as foreign tissue and mounts an immune response, which is what we call rejection. And what it's trying to do is get rid of that tissue. Thankfully, rejection in corneal transplantation is relatively rare compared to other solid organ transplants like kidneys or livers. So we don't see rejection that commonly, but it can occur, and patients can remain on immunosuppressant drops, even just one drop a day for many years to try and prevent rejection occurring. If it does occur, it tends to occur early on, within the first 1 or 2 years. And if we catch it very early, it's relatively easy to treat, and we can usually reverse the rejection, and the patient can carry on without any sort of long-term detriment to the corneal transplant.
Thank you. Thank you so much for talking to me today, Dr. Angunawela.
It's been a pleasure, Joanne.